Greetings everybody. Today our topic of discussion is drugs in general anesthesia, which is a part in general medicine. So drugs in general anesthesia, we have divided these topics into the three main steps. The first one is sedation and amnesia. We will give sedatives just to set sedation in a patient before the surgery, and then we will give drugs just to set an amnesia, or we can say lack of awareness. Amnesia is called lack of awareness. So, is a sedatives and amnestic, two types of agents is used. The one is called induction agent. An induction agent is usually use IV agents. And the second one is maintenance agent. And always remember, maintenance agents are usually inhalational agent. Inhalational agent, which is not used, is intravenous injection. So let's study the first one, which is induction agent. Induction agent. The most commonly used induction agent is propofol. The most commonly used induction agent is propofol. And always remember, the action of the propofol is very fast. Like we can say, within 90 seconds, the patient will fall asleep. And why propofol is used mostly before the surgery is a induction agent? Because of the least side effects. And least side effects like nausea and vomiting in post-operative patient, or we can say post-operative complications like the nausea and vomiting, chances are very less. But always remember, the one adverse effect of the induction agent, like propofol, is hypotension. Hypotension means the patient may goes into the low blood pressure condition, low BP condition. So always remember, once you used propofol, the patient blood pressure has to be monitored during the whole surgery. And the second induction agent is actually benzodiazepine. Benzodiazepine, let's study its mechanism of action shortly. It acts on the GABA A receptor. And as you know that GABA A receptor is actually form the inhibitory mechanism. So inhibitory means it decrease the ongoing function further. GABA A receptor, it cause the inhibition of the ongoing functions. So once we give benzodiazepine to a patient, is a sedatives, the ongoing functions is decreased further. And always remember, the benzodiazepine, it actually increase the frequency of opening of GABA A receptor. It increase frequency of GABA A receptor opening. The example of benzodiazepine used most commonly is midazolam, which is used as a sedative. The third one sedative used is actually barbiturates. Its mechanism of action is same as that of benzodiazepine. It also acts on the GABA A receptor. But the difference is benzodiazepine increase the frequency of GABA A receptor opening, and it increase the duration of the GABA A receptor opening. The only difference between the barbiturates and benzodiazepine is benzodiazepine, it increase the frequency of GABA A receptor opening, and barbiturates, it increase the duration of the GABA A receptor opening. The most common example is thiopentone. So midazolam is benzodiazepine, use is a sedatives, and thiopentone is actually barbiturates, use is a sedative. The fourth sedative use is actually Etomidate. Etomidate. Always remember that etomidate has no analgesic property. It has no analgesic properties. I mean, there is no pain control in etomidate. Pain control is almost zero in etomidate, and benzodiazepine and barbiturates has some sort of pain control properties. And always remember that etomidate is used in a patient with a cardiac and respiratory disease. Cardiac and used in a patient with cardiac plus respiratory diseases. Why it is used in cardiac and respiratory disease patient? Because it has less effects on the cardiac and respiratory system or the cardiac and respiratory patient. The fifth sedative use is catamine. Catamine. And actually catamine cause dissociative anesthesia. Dissociative anesthesia. Dissociative anesthesia means the patient who are conscious, but it gives analgesia to the patient, it gives catatonia to the patient. Catatonia means not able to move, and it gives amnesia to the patient. Three property it gives to the patient. The first one is analgesia plus catatonia, and the third one is amnesia. Catatonia is not able to move. Amnesia means lack of awareness. So this is MCQs. Always remember which of the following drug cause dissociative anesthesia. So the option is catamine. The second drug in the general anesthesia is muscle relaxants. The second one is muscle relaxants. Muscle relaxation. The drug used is called muscle relaxants. Always remember that there are two types of muscle relaxants used. The first one is depolarizing reactants, and the second one is non-depolarizing non-depolarizing reactants. What is depolarizing muscle reluctance? In this reluctance actually do continuous again and again depolarization of the muscles, actually skeletal muscles, again and again depolarization. So eventually the muscle get tired because of the no time of repolarization. So the muscle goes into a relaxed state. Always remember, this depolarizing agent is used for the depolarization again and again, and there is no chances of the repolarization. No chances of repolarization means no chances of contraction. So there is no chance that the muscles contract and relax, but eventually the muscle get tired and goes into the relaxed state. And the best example of the depolarizing muscle relaxant is succinylcholine. The one disadvantage or side effects of the succinylcholine is it can cause malignant hyperthermia. But why we are using this succinylcholine? Because of its rapid action. Plus rapid recovery. That's why we are using this drugs as a muscle relaxant. The second one is non-polarizing agents. The non-polarizing agents has different types, like for example vicuronium and atrocuronium. So remember the example, succinylcholine is a depolarizing muscle relaxant, and the vicuronium and atrocuronium, it is actually non-depolarizing agents. The third step is we have to give analgesia to the patient before any type of surgery. Analgesia means pain control drugs. And analgesia we commonly use stepwise approach is done is analgesia. Like for example, the first one is paracetamol plus aspirin. Paracetamol plus aspirin. If it doesn't work, then we will add paracetamol plus NSAIDs, non-steroidal anti-inflammatory drugs, and codeine. And if it doesn't work, then we will go to the paracetamol plus NSAIDs plus morphine IM injection, intramuscular injection. If eventually it doesn't work, then our last option is paracetamol plus NSAIDs plus morphine, and we will add some regional blocks. Regional blocks are, we can say, nerves blocks, direct nerves block. So these three steps which are used